Hey everybody, welcome back to OK Aussie
Hi.
with Diane and
Cookie. Well,
Powder
it's,
Puff.
it's not cookie, it's macaroon, but it does look like a cookie. But she doesn't have a name. Lucy,
Lucy, your
Winston.
squishmallow weighted putty cat does have a name, and Winston the cat has
Yes, she
the
does.
dog's name.
Winston's always had a name.
Okay.
This,
Right.
um,
Oreo.
no, that's so unoriginal.
Sorry, trying to help here.
I don't give normal names to things. Everyone says that about my cats, although I've gone more mainstream now with cats.
You're less radicalised on
Less
the naming
radicalised on
conventions.
namings.
Oh, okay.
This could be the pink cloud.
Pink cloud.
Because as a
But
little
it's not a
girl,
cloud.
I always wanted to touch the clouds.
You
And
do
when I was
actually.
first told I'm going on a plane, I said, I can touch the clouds. Mum said, no, the windows don't open.
No. Well, that's probably a good prelude into what we're talking about today. Today's conversation is actually about GDD and IDD. What is it? How it actually impacts Diane, and what can be done for those around her,
Yeah.
people, professionals, to better engage and make accommodations to suit, because it ain't going away. It's what you have to deal with.
It
Now,
gets
first of all,
harder.
absolutely, and it actually does. I'm going to talk about that specifically
I'm
in relation to
51 now.
22q, for genetic condition. So, global developmental delays, GDD, intellectual developmental disorder, IDD, both refer to significant delays in developmental milestones, motor skills, speech, cognition. GDD is actually only a temporary label. It's a holding label for the first 5 years of age, from birth to 5.
And that was me.
For those who haven't actually met milestones at the end of the day, IDD applies to individuals 5 and above. Okay, so now that we've got a bit of a picture of who that person is, we can start to say, do they have intellectual or developmental or both
Yes.
delays? And that's normally defined by standardized testing, IQ
Teacher,
levels,
straight away.
and significant adaptive behavioural deficits.
Got singled out.
You did, didn't you? Very early on, and you had lots of learning
My teacher,
disabilities
my very
along
first
that.
teacher, the very first teacher to
Day
meet
one.
me out of my home,
Yeah.
and I was in a very, what is a community where everyone knows
Closed,
everybody,
connected.
and they just don't really judge things and have those types of concerns because it is a community of pure. It's like one big family.
It is an extended family, and it's
Yeah,
because
so
it's a
when
small
I
country
stepped
town.
out of that, basically my first experience at school, because I didn't have the developmental ability to do preschool, so I went
So you actually
straight
skipped.
to year one,
Mm-hmm.
and it was picked up straight away.
I think it would have been. We're going to talk about some of those examples as we go along. Now, underlying all of this for Diane is that genetic chromosomal disorder 22q11.2 deletion syndrome. It used to be called things like DiGeorge syndrome. There's lots of other names, cardiofacial syndrome, etc. But this is a genetic disorder. Diane is missing 30 to 50 genes, 3 million DNA building blocks. It equates.
genes are gone?
Your genes are definitely going girlfriend. And anywhere up to 185 clinical symptoms. Now, some of those symptoms come into the display because it's a neurodevelopmental condition.
That was funny.
Autism, 14 to 50% of people with 22q will have autism. 40 to 60% of people with 22q will be ADHD. You're also going to throw in conditions such as Tourette's,
Guilty.
okay, and OCD.
As charged.
But it's really about the learning
Yes,
disabilities
Judge.
at the end
Arrest
of the day.
me.
22q is specifically known because it commonly causes both global developmental delays, GDD, and intellectual disability,
I got
the
the
IDD
lottery
or
on that
ID,
one.
absolutely. Along with other neurodevelopmental challenges. Like I said, the autism throws a spanner in the works as well. It's one of the most common causes of developmental delay, with symptoms often starting in early childhood and persisting as learning disabilities into adulthood as we go along.
However, someone with 22q can have IDD without autism.
Correct.
So there's sometimes a difference, isn't there?
Well, like I said, there's only
But
14.
guess what? Also, Down syndrome has IDD as well.
Yep, absolutely.
combos.
So 14 to
spectrum.
50% of those with 22q will be autistic. Okay, so the painting the
Yes.
picture are around that. Now, of course, if you've met one person with 22q or one person with autism, it's only one person that you've actually met. Hello, Maximus. If you come to say hello,
Do you want to
cheeky
cuddle
little
your
monkey.
mama?
Now, while the
This-
severity varies, many individuals with 22q deletion syndrome have either mild to moderate. Now, there's 4 different levels or scales in IDD which we're going to go through. The mild represents the bulk of people. Okay, moderate's only about 20%, severe is about 5%, and profound is about 1%. Okay, so the majority of people sit into that mild category. And of course, it can have on some of the aspects of scaling. You could be a bit like autism. You could be a little bit more autistic on one day to another day, or certain aspects of your autism along that spectrum might be more profound than other aspects as well.
That's true.
Definitely.
It's a weird concoction
It
of
is.
spectrum.
Now, with the cognitive profile often includes specific difficulties with mathematics, problem solving, abstract
They
thinking.
kept saying that to me at school.
I know, right?
You can't problem solve at all.
Now, you also had
Everyone
dyslexia.
else was beating
You
me.
were flipping things
special
around,
ed.
letters and numbers. You've got dysgraphia and dyscalculia. They're all learning disabilities. You were in special ed your entire primary school education.
I was so special ed that I would literally, when I was starting to speak, they'd say, I want you to count these blocks for me and put them in groups of whatever this or do this. And I would go, I don't want to do that.
Okay.
That's
A bit
how
of PDD,
much, No, like that's just how unaware of, that's something that maybe a 3-year-old would say, right?
Yeah.
But me saying it like at 11, that's what I was like because I didn't understand. I was like, I don't have to do this.
100%. Now, there is a trajectory with this condition. While early severe IDD is less common in 22q, some individuals may experience a cognitive decline or a widening gap of cognitive performance relative to their peers as they get older. So you're seeing your peers achieve, become more competent, more independent.
Started when I was just leaving uni because I was just in the middle 20s and that's the age group when, look, my school friends were in my life. I was very blessed. I've got great school friends and they were in my life, but that was just because I went to a school I was the first year group. So it was a safe, secure school who made allowances for my special needs with the guidance counsellor, with the school psychologist, having chats, which was so funny. I loved having chats with her. And then I was allowed to walk in and out of class whenever I wanted to cope because they knew of my needs. But after 25, I couldn't make or keep friends because they were more...
They were going this way.
They're going up and
continuing
I didn't
to grow and develop.
have the ability. It wasn't like... a situation of, some mean people don't end up with friends. It was a situation of I couldn't, I was just quiet because I didn't have the ability to keep up with them and grow with them.
Well, we're going to talk about some of your earlier
here.
childhood experiences as well, because that relates to this in just a moment. So there's adaptive functioning, challenges that exist in daily living. That's with living skills, social interaction, conceptual, social and practical domains. The research for 22q indicate that individuals like yourself often experience a progressive decline in cognitive function and intellectual abilities rather than the static intellectual disability.
Is that why some things that I've
But
said
decline's
to
not
you
universal, okay.
I said to you, this is primary school, this is high school lately. I've been saying that.
Yeah.
Oh, I'm back to what I used to do.
You're
in high
noting
school.
the
I'm back to
regression.
what
And look, after thousands of seizures, which we've obviously
That's
tracked
it?
through the channel, it's expected with the condition. It's in the clinical guidelines.
Right.
It's for neurologists,
22q
behavioural,
for
a whole lot of it.
neurology.
We're meant to expect that with 22q 11.2 deletion syndrome, and even your IQ is going to decrease, probably up to about 7 to 9
I can't
full
spell
scale
words anymore,
IQ points.
Guys, I'm at that primary school with words at the moment where I went to write the word break as in B-R-A-K-E, K-E. Sorry for my speech problems. I had a seizure yesterday. And I wrote it B-R-A-C, and then I got stuck I literally didn't know how to spell break. And I asked you, didn't I? I said,
Absolutely.
how do I spell break?
Now,
So
this is interesting
that's
because,
bad.
again, this is why we do the channel, to educate and advocate,
Mm.
but to actually
I worked
capture
so
in real
hard to
time
get rid of that.
what's going on. Now, if I may for the moment, before we go into a lot of things, because I'm going to give some of these examples,
Go for it.
it's very important that we actually share this information to create context around what Diane is experiencing. How, just like you're saying with the word finding, the stuttering and the slurring, the aphasia, Diane's really declined further because of having so many seizures, and that post-ictal aphasia is sticking around now. She's been tested by neuropsychologists and extensive testing, and we're finding that short-term memory, like Dory the goldfish, she literally is forgetting things. She will forget things that you've just spoken about only a few seconds beforehand.
Yes.
Whereas the opposite of that, in another video, as you've seen with HSAM, that
remember long-term
highly
memories.
superior autobiographical memory coming into her sorry, that's a very pretty ring. Thanks for distraction. Let's focus on what we're doing at the moment, if we
Sorry.
can. That's okay. And this is
I was
part
trying to let
of
you speak.
where your struggles come from
I'm
with
letting
dealing
you
with
speak,
ADHD and
because
everything
I
else.
don't want to interrupt.
That's okay. So with that, I wanted to actually focus on the why. And it's important for us to know the why, to be able to accept and acknowledge. Make accommodations for, and this goes in day-to-day living, whether it's connections with friends, acquaintances, family, whether it's to do with supports or clinical. People need to understand that Diane's a bit different. She's not maybe like everybody else in the population. Well, we already know that with a condition like 22q, which ranges between 1 in 2,000 to 1 in 4,000 people, as a primary care physician was saying only yesterday, it's actually very rare. You don't see that many people, and in fact,
We worked out there's probably 15 to 20 in Perth,
yeah,
whole of Western Australia.
and I think I've only heard of 2 or 3
not
in
many,
Perth,
guys.
so it's not that many that actually exist
in
with a
my
condition.
state,
And that's why with
it's
rare,
a big one.
and remembering too, there's over 7,000 rare conditions. Only 5% of those rare conditions have got any treatment or management plan. They take 8 to 10 years to get diagnosis. Diane took 48 years to get diagnosis, even though it's been incredibly clear through all her education that she's got initially global developmental delays, that stepped
Yes,
into
school.
intellectual and developmental delays all the
Well,
way
at
through
school they
childhood,
called it
adolescent and adult.
retardation.
That was the language that we used
Yeah.
back in the era, wasn't it? But what I'm also saying is the context, people can get very confused. I talk about HSAM, that highly superior autobiographic,
about
hold on
those
2 seconds,
fractions?
highly superior autobiographic memory. So she's got an incredible recall of long-term memory related issues, but then she can't tie her own shoelaces. She'll forget whilst we're in a conversation, and like you're seeing at the moment, she's going off in different tangents. That's why she's got a fidget toy out. She's using her toolbox to actually help her to avoid jumping in and distracting. This is one of the things why Diane will find it difficult staying on task, staying focused in the conversation, and not entering into a lot of historical grabs.
Fractions at 23.
Yes, you did.
And I had a mathematician teacher that I went to this maths class, right? And she said, well, you just learned fractions. And I was like, that's it, fractions? That's all of it? And she goes, yes. And I was like, yay! I was so excited.
Absolutely.
When do people normally learn fractions?
Well, again, fractions you start learning normally in junior primary. Middle to junior
That's what I
primary,
thought.
you're going through all of
So
those
that's
sort of
just an
things.
example.
Yeah. Now, I also want to put that in context because I'm
Just-
glad you gave that example. Learning fractions
And
at
times
23
table.
and even
I
times
still-
table.
I still
Times
can't do
table you're
times
starting to
tables.
learn at grades
I still
2.
can't do it.
Right.
I still can't do it.
But here's the flip
Like
side.
other adults.
A bit like the example I'm saying you can't tie your shoelaces. On the other hand, though, you've gone not only to high school, you then later on went
My
on to
special interest.
TAFE, Technical and Further Education. You also then went on to university, and at university you've studied a very complex subject,
degree,
a
yeah.
science degree of
Psychology.
psychology, and actually
Not
were
the counselling
awarded
one.
with some of the highest level grades in assignments
Yeah.
and exams and for the course, but also completing some of the puzzles, some of the
Maths.
challenges that were provided that other students in your cohort have never been able to achieve in multiple years when it's presented.
Except my friends would laugh at me. It was a loving way with me. They were my
Your
university
friends, yeah.
But they would laugh, like, you take 3 hours, I do it in 15 minutes. That's
Right.
the chapters. So for our main psychology, if anyone's been to uni, you have your main core subjects, and it's core psychology. And so there was each psychology lecture, you had 2 different psychology units a semester.
Yep.
And I said, it takes me 3 hours to read the chapter and write a few notes, ready for your exam, ready for whatever, to learn, of course. And my friends are like, I do the same thing, and I knew because I'd seen what they do. They did exactly what I did, took the same amount of notes and the same kind of notes, and it took them 15 minutes.
Right, so on one hand it's 15 minutes, you take maybe 3 hours. They might take 1 hour to do something, you take 8 hours to do
I
something.
took 7
You
hours.
can do things. So
to
as I'm
do
saying
my
here,
statistics,
individuals, and Diane has actually
5-minute
got
questions.
moderate intellectual disability on the scale
I
of
didn't
things.
know everyone
So
did it quicker.
individuals with moderate intellectual disability in 22Q can still attend university, but with supports.
harder
They
work.
typically do so through specialised inclusive higher education programs rather than the traditional full degree
Well,
pathways.
I didn't get
These
that.
programs are designed to provide tailored support focusing on independence, social skills and vocational care.
I
You
didn't
did get
get
that, and
that.
that failed you as well because you
But
didn't have accommodations
I
to help.
had friends that when I said, I don't understand that mathematical thing, they're like, oh, look, I'll just tell you. And also, because I was unaware of the universal factor that if it takes me 3 hours and then 15 minutes to do a chapter reading and a bit of notes, I just didn't click that the assignment time that I was spending, the time spending on my statistical studies, all of those things, I assumed all of those hours I spent was what they were all doing, but they weren't.
Now, let me back up a step. You're born prematurely in a NICU,
Yeah.
humidity crib. You're a miracle baby because no one expected
Shouldn't have
you
survived,
to
really,
survive.
yeah.
And that, unfortunately, with a cohort of children with 22Q, particularly
That's
low
common,
genetic
sadly.
anomalies, it can actually lead to that. Okay, the lifetime, it's 41.5 years of age is the average age for these patients. They're very lucky if they get to reach 50. A lot of the time, it's with challenges such as the developmental and
pretty
intellectual
challenging,
developmental
isn't it?
delays. This is why in the international clinical guidelines, there's high recommendations for having guardianship and supports to be able to transfer
From
through
18.
life. 20, maybe 18% of these people are lucky if they're able to build relationships and go on to get things like married, like we've been able to do ourselves.
It's only because you're
rare.
an abnormal person in the sense
Thank you.
that
Very abnormal, actually.
there's not many people that are kind, and I think that we thought there was more than what there was, but this war is telling me, this is just my personal opinion, and anyone can say what they want, but it's a choice. Some people choose to be bad and join in with the other bad, and some people have chosen to be good. So it depends on the choice, but unfortunately it's popular to be nasty and bad, but you're a good person, kind person, and you've always taken care of me like the other good people, like you followers who, a lot of you are very good to me.
Now, if we can talk
and
to
you
that,
give me the ability to
keep
feel
focused on the
included.
topic.
So
Exactly.
I've been able to have a partnership and be a mother with that support that you've given me.
so that shows that for success, there needs to be accommodations
supportive partner
of
that's
support
a
around you.
guardian
The
slash partner.
community around you needs to be understanding that
Yeah.
you're different. You have
Yeah.
needs that need to be
and
accommodated
notice
for.
that I need help. You
Correct.
and your mum knew I needed
And
this
we're
help,
able to
that
step
help,
in
this
and
help.
work that out as we went along.
Exactly, and your dad.
And look, there's been a challenge. We've taken years to
Hasn't
build a
been
profile
easy.
to work out who you happen to
But we
be,
know why now.
particularly
It's
with
22Q.
late diagnosis.
Yeah.
But now it actually unravels, particularly with the clinical guidelines and all of the peer-reviewed medical research on this topic. It allows us to understand what patients in this cohort are actually facing, what they develop. There's no longitudinal studies because it's up to probably about 30 years of age, because a lot of those patients haven't lived that long. They haven't been
don't.
able to do that data, and it's
That's
still
why
only
I
evolving
can't
with
believe
research.
some people in my comments, it's not you good people, they just don't get how sick I am, how life and death our days are
Yep.
on a daily basis. It's beyond most doctors even.
Well, correct.
I
Most
need
doctors.
fruitamide break. I'm so
No worries,
sorry.
toilet break. Okay,
I'm
fruitamide breaks.
sorry.
Fruitamide's a loop diuretic if you don't
Fruitamide.
understand that. And with full body edema, Diana's frequently
I'm
backwards
a
and
lot
forwards.
skinnier today. Sorry.
It starts pumping up. Now,
It's nice.
and I'm glad you mentioned what you've done because
Tummy's not
the
so-
accommodations, the understanding needs to be around you for you to be able to thrive. You're born with a condition that, first of all, has got a failure to thrive. You've
That's
got
why
small
I'm very-
head
And
size,
guys, you wouldn't
microcephaly,
believe
and
it, like,
small body stature.
I am more small if you met me in real life. I know that it's deceptive because a lot
Makes
of
you
people
look
say,
big on TV,
oh, yeah,
doesn't
like
it?
I'm small like you. I've had friends like that. And then we go to try something on and they go, you really are small. And I'm like, I am child size 4 My ring finger for, you know, like our fittings of rings was a 4. Now it's a 5, only because my knuckles have grown.
Yeah.
Like, I am child size for everything. The hospital has to get child size cuffs.
Very true, because every time we are in
Child-sized
the
mask,
adult hospital, they have to go back across to the
everything.
pediatrics or young
tiny.
adolescents. And that goes for every component. So you are small in size and development,
It's
and
not
that's
just
important.
height, it's also size of your body. I don't know how to
Correct.
explain
Now,
it.
if I may, you've obviously also got the other aspects of this. You've got an ADHD brain that can go easily off on tangents. You've seen that in this video today, and that's why Diane's using the sensory tool to try and focus
To try and
in.
shut up.
I'm not trying to shut up, but trying to
I am. I'm
focus
trying to
and
shut up.
participate.
I
You
need
have an
to.
inability with
I
the
have to.
crossover of following the rules, the social
rules.
rules,
I
the
have to
sharing of
really
space
speak.
and talking. That's a huge challenge for Dom. So there's got to be a huge level of understanding. We're going to go to in this conversation some of the things that need to be made as accommodations, because to expect someone to do better than, more than their capability really is discrimination against a disability, right?
My psychiatrist said anyone that makes you have expectations above your developmental ability, just know it's abuse when they do that.
Correct. That's exactly
And
right.
I
So
was
that
like,
summarizes what I just said.
Huh?
Mm.
You know, like he said, like that is considered abuse.
Now,
You can't treat, that's why you can't treat children a certain way.
And some of the earlier challenges that Diane had as an autistic was, first of all, she was mute. She took a longer time to learn to speak, to find her words. She was selective mute up to 11 years of age. Her schooling in primary school, when she transfers into the high school arena, she comes out and finishes
very
high school at
selective.
only year 11, but only with a primary school scale of education. It was unless
I was
and
year
until
7, but
someone-
not even a good year 7.
no, but it was until a family member who was a very significant
Another
advanced
good one.
educator.
Another good one that
good one.
saw that I had a lot
Differences.
of problems and
It tapped
wasn't
into you
coping. Yes.
and worked out how do you learn.
Correct.
to
She
help
was
you
so
to learn.
patient because she's a religious woman. And I'm not saying that people that aren't religious aren't patient too, but she was absolutely
That was her persona,
an
and she was
amazing
patient, and she
educator.
gave you that time. And time is important.
Yes.
You'll see that in some of the
Time.
strategies. And
She
these
did.
strategies, if you deal with any of these things yourself,
Every
you might
Saturday
have autism,
afternoon.
and autism sometimes comes with the IDD component. You might have another genetic condition as well, and many genetic conditions can predispose you into having difficulties with either the GDD and stepping into IDD later in life. And they might be simply turned by the lay people, oh look, you've got some learning delays, or slower at learning, or you need more time. Or there might actually be real challenges where you cannot actually increase your IQ above that range. You will never know above that capacity. You're about to say?
Sorry, I'm not good at this, am I? I'm sorry. Like, no, I was just saying, like, I wish I could be back at uni.
Right, and why do you say that?
Because I love it. Like, it's just my happy place.
Okay.
And I feel like, I guess it's just, I feel like I'm missing out on a career. I never got to have like a career.
Okay, that's a good explanation. You probably just saw me use a why question. Keep that in mind as we come a little bit later into this conversation as well, because the language that you use, whether it's a professional, clinical engagement, whether it's just a friendship or a social engagement, it's not about shutting Diane out. It's actually how can you enhance her interaction, her fulfillment, her success, her engagement, and participation in the conversation to feel that she's part of it, feel that she's being heard, that it actually is important, that it matters. Because you know what? That's the respect part that should be happening. A lot of the time, in particular autism, you might hear the term infantilization, and that's actually not a good thing.
I say to people, and I'll describe it to you guys because I am good at acting certain things when I'm in a certain ADHD mood. You've seen my shorts, but basically I call it the preschool voice. And if someone uses what I call the preschool voice, I say to them, please just talk to me normally. And
That's a good response.
most of them actually do respect that and go, oh, and then they do.
Mhm.
So they don't, like the medical practitioners that do this, they really are unaware.
Here's another one for you. Do you understand? Did you see what I did there though? Some people do that. They
think
talk
I'm-
very slow,
No,
but
you know
also very
what?
loud.
They
Do you
think
need that?
I understand and I don't.
No, but that's
'Cause
also
remember,
one
I
of the
keep
mistakes that's
asking
made.
people, why do people say that? It's sarcasm, guys. It's sarcasm, and
Right.
it doesn't make sense.
It
So
hurts you, it upsets you.
Yeah, it makes me scared.
Right.
It makes me.
Intimidated, and it's okay to have emotions. Emotions are okay, people. Okay, emotions are not a bad thing. Getting angry is not a bad thing. And also, just want to tap into that too, by the way. Pre-ictal to seizures, you're going to have emotions if you actually have a real seizure condition, by the way. It's quite a common aura before a seizure is the fear, the dread, the anger. Also, if you've got cardiac, if you're having heart attacks and other events, your person might change after a heart attack or a stroke because they've got a increased anger. It changes mood. Diane's dealing with multiple conditions. Hey, try and deal with incredible pain. I remember when I used to have migraines all the time.
Yeah, that
Fuck
was
me.
bad.
I felt angry, okay? Because I'm in intense pain that no medication could actually subside. You imagine having to go into a dark room for 3 days for the pain just and
It
the
was bad.
nausea to stop.
He was severe.
So the
guys.
context, it's not about me. The context here is I just want to paint a picture. Some people will sometimes comment along the way, oh, there's toxicity or anger or frustration. Yeah, there's a lot that we're dealing with. Our life is not maybe like yours. Our life is
not
actually
Disneyland.
not a positive experience. In fact, we're fighting some of the biggest systems having to advocate, and Diane, because of GDD and IDD, can't self-advocate. She can't always get her message across. She can't communicate her points. She can
That's
get
why
distracted,
I'm in this position.
which is why I'm in the position. So sorry to interrupt you, but I thought, and on a break for you just
But
to
that's what
recollect
people
you.
say all the time because everyone thinks that I do understand and they get mad about it.
Correct.
And I legitimately, I do not understand.
You don't understand. Thank you.
and
That's all I need to say.
can't
Thank you.
understand. No matter how many times they say it, I'll never
Right.
understand.
Correct. So we can't change what we can't change. That's probably a good statement. Also, talking to the person as if they are and diminutively dumb, going and talking in a slow voice like I did in that example, or talking loud. Just because I'm talking loud is not going to make it sink into the brain any better. Okay, and that's another one of the strategies that we're going to talk about at
It
the end.
shuts off an autistic
Also,
brain.
as an adult, you should be
It's loud.
treated as an adult, not infantilized. But we're going to talk about some of those things because I've put into context you've had challenges of ADHD, the autism, selective mutism, comorbidities with health, you've got Tourette's that throws in, sometimes unwarranted positions, but today's focus is on the IDD. And we're going to get now into that in a bit more depth. So pause with me for the moment as you recollect. I want to talk about some of the key differences and details. Age and diagnosis. GDD is used when a child is too young to completely the standard IQ testing, which is usually under 5. So while IDD is used for older children and adults. So that's the term of reference. If you hear that, you would be saying, look, when I was born, I was dealing with GDD at the time. After 5 years of age, we tend to throw that term away and then we go into
Well, why did they use
intellectual
it at school
developmental
for me?
disorder. Because a lot of those
it's
things
like-
weren't defined.
Because when I would do,
They
you
should
said-
say that in the context of you had GDD. Now, as we're
They
seeing
said
in the
I
school
still
environment,
had it at school. Maybe they used it different back then.
it was because they're still also trying to create that frame of reference. They're still also
Yeah.
evolving in
Because
their
what
learning and
happened
definitions, a
is,
bit like the DSM,
even
Diagnostic
with my
Statistical
phys
Manual.
ed teacher,
Mhm.
I couldn't do I couldn't learn to skip
Yep.
at the same age as other
Synchronicity,
kids.
yep.
I couldn't learn like the 3 jump thing for
Triple jump.
triple jump.
Yep.
I couldn't do certain, when they do like activities for gross motor skills, I couldn't do them yet.
Sure.
I could do sprinting. That was like I should have been
Speeding
on
bullet.
the state team. A teacher told me because I'm so fast.
Yeah.
I'm
You
good
got
at
fast
my
twitch muscle
athletics,
fibers. Yep.
and I love being active because I have ADHD.
That's strengths, and that's really good to work
but
to
they,
strengths.
they were confused with, then why can't she skip? Why can't she do,
Which comes back
all
to
this
the
coordinated physics?
developmental delays. Now, they may have predisposed the language wrong. They use GDD. We're learning here, we're being very precise. That's for 0 to 5 years of age. In that era of time, back in the 70s,
That's
when you were
before
going
over.
through, absolutely,
All the
they
time.
would have used other words, just like they would have used retard instead of
Yeah.
the nicer words autism as they do now.
That's the
That
historical
was the
name for it.
era at the time.
It's the historical
But you had
name,
gross
sadly.
motor coordination. You couldn't
Yeah.
synchronize. You
And
couldn't
fine motor
flow and
problems
fine
as
motor
well,
things.
yeah.
All right. Now, the progression. Many children who are diagnosed with GDD, initially, pediatrics, eventually receive an IDD diagnosis. Not always the case, but the majority of the time they will go on. If they've had difficulties earlier, they'll tend to go on, unless a lot of interventions. And if you get early interventions into place, that helps massively. I mean, I had a lot of issues. My coordination was shit at the very beginning. Absolutely. Even my speech, I had a lot of problems, and I had to go to a speech therapist, which a lot of autistics or people with genetic disorders would have to actually go through and do. And then you learn ways, and you build your toolbox. Now, the domains that are affected both involve delays in 2 or more areas, including fine and gross motor skills, which you've just talked about, speech and language, and also the social and emotional development.
I just didn't see anything, and people are like,
yeah.
Didn't you just see what happened then? This happened, and I'm like,
yeah.
I was there, and that did not happen.
But look at those 3
How
different
do they know
domains.
these things?
Gross and fine motor skills, speech and language. So you were slower to learn than others in your cohort. You wouldn't have been able to use bigger words. You wouldn't have been able to string words together.
I was told to stop
and then
speaking
from the
so immature.
Right. And that's
I was told
all
that.
the way along. You still hear that
At
even
school.
today.
At school, it was like, stop talking immature.
Right. And then also the social and
way.
emotional development. You spend a lot of your earlier childhood with children who are 2, 3, 4, even 5 years younger than you.
In high school.
Because you were then matching. You
Dancing.
self-moderated yourself to actually match
Because
into people.
developmentally, I think we were there.
That's right.
I loved playing Barbies when I was like 14.
Yep.
With an 11-year-old neighbour.
Yeah.
We had the best
So that brings you
time.
joy. It's at a
was
level
so
which you
much
could
fun
cope
because
with.
Barbie's younger. I was like, what do I do with this?
Right.
So I'll just pull the arm off and I'll take the clothes
Fair
off.
enough. Take the
But
arm off.
when I got to I was 14, I was like, and I actually said to this friend, oh, like how do you want to play Barbies? Because I was old enough to ask that. So I think, okay, I need her to tell me right now. Like I'm fluking it here. And she said, well, what we'll do is we're going to put all the stuff in the middle, divide it up, and build a little house. And so we built little houses. And
A lot
everything in place.
of autistics
It's so
can be
fun.
identified earlier on because they might
I
be.
miss that.
Sorry, they might be as autistics early on, sequencing things in a row. You put all your cars in a row. You might be playing by yourself rather than playing with the other children and the Barbies and doing things. No, I wanted to mention that. At the very beginning of this video, you would have seen a few little snapshots of Diane's room and her house, the things that she collects. A lot of autistics like to collect special interests.
It's a bit of a problem.
But there are also things that bring you joy. But a lot of those things can be seen as being immature. But then that actually matches in with
My
IDD.
one isn't.
No, but it matches in with your IDD. If that's your level of where you're at and it brings you joy, is there any harm in that? No. If it brings you happiness, should you be expected to do something above your capabilities, something that's not you, just to fit into society, as an example?
No, because I'd be sad. That's like saying to adults, hey, I want you to go all live like children and don't complain about it because you need to, because it's the popular thing, right?
Yeah.
That's what people are asking me to do.
Okay.
It's like, go and live in a way that's just not natural to you, where you're just going to be frustrated and just don't complain.
100%.
For my comfort.
So-
it's like your comfort, not saying this to be mean, but other people's comfort is not my problem.
No, exactly.
People
You need to
don't
look
have
after yourself, your
to
needs.
watch my channel. People don't have to talk to me in my real life to people. That's their choice.
Thank you for that. Now, this is another thing which we should always say. Our channel might not actually be suited to you. That's okay. Why? No problems at all. If you like, if you relate, if you have compassion, if you have an interest in learning and evolving, I didn't choose to have to learn all these things. It just became a situation of being in situ. We needed to know what was going on. And of course, with a research brain, I had to go in and find out more to understand how Diane ticks and realise no wonder a lot of professionals aren't getting it. It's
And
so
safety
rare.
as well in society.
But then
I'm not
how
safe.
do we connect? How do we actually bring the best of Diane out to make it a really positive experience in
And
everything?
I've needed to be kept safe.
You have,
and
actually.
your mum have kept me safe
Now,
because things aren't safe for
the
me.
causes of this condition. Now,
Yeah.
both GDD and IDD are considered to have similar, highly diverse etiologies with genetic factors the majority of the time.
Interesting.
Look, you can also see this in
Autism is genetic, by the way, guys. Like, they are still looking, I think, for the exact like combination of genomes or whatever, but it is genetic. So
Correct.
in the future, you'll probably see it taken out. I've been studying it, taken out of the DSM and put under a genetic
they'll continue to
It's a
evolve their
condition,
learning and the way
not-
they
not a mental
approach that.
illness.
Now, genetically, we understand that Diane's condition, DiGeorge, as it used to be called, 22q11.2 deletion syndrome, the appropriate molecular name for it, is expected to have GDD and IDD. There's other genetic conditions that can. Some people who might be FASD, for example, because their mother alcohol
Drunk
or
alcohol.
smoked or whatever else during the pregnancy, drugs, those sort of things can also
Apparently
have
that can
impacts
cause
on the
it too.
development,
Yeah.
obviously in the womb of the newborn,
of the
and that
brain.
can cause that to occur.
Yeah.
Okay, there are chromosomal microarray testing that can be done for microdeletions, FISC example, and that will then identify that it's about 40 to 80%
And I
of
do
these
recommend-
cases are genetic.
If you have a lot of complex symptoms and you are someone that's because I get a lot of people saying, oh, I'm not diagnosed with anything. Normally they're the mean ones, but basically there's always a reason you're not well. There's always a reason you've got a physical
underlying
condition.
related
So
issue.
I do recommend genetic testing.
100%. And remember, it does take 8 to 10 years generally to get diagnoses of rare conditions. All those 7,000 rare conditions on average take 8 to 10 years. Diane took 48 years. So it's no surprise of the era that she came through and the environmental variables that caused her to have a delay. And then once you do get that diagnosis, because genetic testing is 99.998% accurate, okay, it's very, very clear once you look at the clinical guidelines for that specific genetic marker, what to expect.
Yeah.
What's coming on. We know what those genes that are missing are related
do
to
something.
developmental disorders
and it's not
such
just
as this.
physical stuff.
Now,
It's gonna do
what's the
something to
management?
brain.
Early detection of GDD is crucial for initiating rehabilitation and early intervention services, particularly in the school and the education system, as the
Yeah.
brain then has high plasticity at that age
Yes.
to improve.
Make
We
the most
still
of
do.
0 to 18.
100%.
Well, actually, 0 to late 20s, I think is, if I look at
Make
my
the most.
life,
I like that
was
term.
my best developmental time.
Yep.
But after that, I declined.
Bingo.
Very slowly now, kind of a bit more fast.
Correct.
But basically, you do need to make the most, whether you're caring for someone with IDD, whether you have IDD, that is your best time of your life. Make the most of it and be prepared for things that do change.
Now, with that decline, okay, fresh my break again, here we go. And that's another toilet break. Every 20 minutes, pretty much on par. That's what we live with around here. Now, the levels of intellectual disability are classified by severity: mild, moderate, severe, and profound. They're based normally on IQ scores, typically below 70, and adaptive functioning in conceptual, social, and also the practical skills of life. These levels help determine the necessary supports that are required for daily living, with most individuals, about 85% of them, having actually what's defined as a disability, a mild disability at the very least, depending on the severity. Now, that's just one aspect. You then look at the physical components, and for example, in Diane's case, she's very much high support needs. She needs 24/7 supervision in case of medical acute risks that can occur from cardiovascular, respiratory, seizures, dystonia, Tourette's, you name it. Anaphylaxis, that level needs to be there. Your functioning in daily life needs to be there. Even as a mother, as a parent, you needed the supports to help you, because otherwise that would have been too overwhelming. It would have been too impossible to get through, and you had those supports to be able to help so that you could actually then do the role of a parent and raise children. So these take extra efforts, but extra supports from the people around you to be able to get through in life, if that makes sense. Now, I just want to talk about the different levels. Mild intellectual disability, that first layer, that's about 85% of cases. Okay, it's an IQ of 50 to 70. Individuals may take longer to learn, but can often acquire academic skills up to about 6th grade level. They can live independently and they can work with minimal supports. Now, these are just very much catch-alls. There's a fluctuation between those levels, but I'm just giving you the baseline definitions.
That's correct then to my tutoring level.
Moderate.
Of year 7.
Yeah, moderate intellectual disability, IQ ranges 35 to 50. That represents about 10% of the overall cases. Individuals can typically learn basic self-care They've got reasonable communication and social skills.
OCD.
They may work in sheltered workshops or supported environments, okay? And your work history pretty much relates that you can never really last long.
No. What happened in all
Accommodations
my
were necessary.
workplaces was, now, the first one, now, because I've been too physically disabled as being like, you know, I've only got a few experiences to pull on. But my first job that I ever had to do that was a proper job, I had a really good friend from school who is a heart of gold soul person who I trust with my life, who I consider family, who I do anything for, right? That ride or die friend, okay? And so she was always do this and do it that way,
Always giving
to
you
protect me from the
instructions.
bullying that was happening,
Support.
which I'm sure
Tips.
my supervisor, because she was like
So you're in a checkout, a
probably
retail
21 or
checkout
something,
operator.
so I'm sure now she's a different person, but at the time that was my bully. And it's because naturally she's thinking, because back in that day this wasn't talked about in Australia, it was
We're not
just
using the
you're
language
going to do a checkout job and shut up. And so she would get frustrated because I never learnt things, I constantly forgot things, I needed
Takes you
assistance,
longer, needs
and so I would
assistance.
get bullied naturally, right? And so she would always try and prevent the bullying from happening by saying,
But interceding.
that's an eggplant, don't forget, it's an eggplant. And
I
I'm
was
like,
wondering what that funny
and
vegetable
I
looked
would
like.
do this because she'd always be in the checkout behind me.
Yeah.
And yeah, she would always, and then even got me out of the, well, I didn't win, but I said, how do I get out of the express lane? It's so frustrating. And she goes, you are too fast.
You need to slow
I
down,
said,
girl.
well, they don't know that. How do they know that? She said, look at the bottom of the receipt.
Every receipt
And
tells
there
you
was
how
like
quick you were.
items per minute. I was like, those people.
Checking
Those
you eyes
people
up.
that are smart.
That example really also portrays, even like the university, you can get through things. You
I had
can
a lot of support.
succeed if the supports are there, if the accommodations are there, if the
Yes.
acknowledgement of the conditions are there. Not the bully, not the supervisor saying you're a dickhead or
Dumb.
you're stupid or whatever else. No, having the supportive friend, having the environment. If they had that language back in those days to
I
actually
was
know
always
what the
bullied,
condition
so
was,
I was called
you
dumb
would have
by
taken
every
longer to do your
supervisor.
training. But boy,
Right.
do you bring such magnificent skills to the job, to the workplace,
That's
particularly
the
with
problem.
OCD and the speed and the wow.
When I get bullied at workplaces, every workplace I've been to, I've been bullied by the supervisors and called stupid.
Right,
And
and that's the
dumb,
common thing that you keep getting
And
imprinted
you're a
with.
dumb blonde,
Right.
and I've had customers devastated for me.
Yeah, because I overhear these things.
And when I do leave the job, normally
Yep.
under medical, they say, but you were my favourite because I do a good job.
You do an exceptional job. So we've talked about mild. That's the 85% of cases. Moderate, that's another 10% of cases. Our last two layers,
Let's check out
severe intellectual disability, IQ 20 to 35, that's about 4% of the cases. Individuals often require significant support for daily living, basic self-care, safety, though they can learn simple routines. And even with safety, we talk about
I
this on
love
the regular...
check-out chicks.
With safety, we talk about this on a regular basis with you
Yeah.
because of your awareness, your ability to be manipulated, financial
I'm scared of
fraud,
adults.
commitments into
I'm scared
contracts.
of adults because I know it.
Right, so
I'm
there's risk
scared
there.
to be alone with adults that maybe I don't know, whatever, because I know that I will not see it coming because for 51 years I've been tricked.
The last layer is known as profound intellectual disability. That's an IQ less than 20. It represents only 1% of the cases. Individuals generally have a limited communication and mobility, require 24-hour supervision, care and nursing support for daily activities.
And they are my special ones. I have a special place in my heart for them because...
Now, appropriately communicating with an adult with a moderate intellectual disability
Could have
involves
been me.
treating them with respect, patience,
Yes.
using concrete, simplified and visually supported language. They may use short and simple sentences. They might rely on augmented alternative communication, AAC devices, and Don, you use your
I
iPad,
do use it
the
in
TD
certain
Snap
things, yeah.
AAC in certain
I don't use
locations.
it on here, guys,
No,
but
when
I
you're
use
overwhelmed.
it in life.
Exactly. And here is a time, and I'm going to keep this in context.
Yeah.
Diane is able to come onto videos when she's in her good space, when she is prepared, when she's
I've got
on a
topic or something.
special interest. She can talk for hours. She can talk for leg off a chair because she
I could
knows
talk
that
to a
inside
professor
out.
of psychology that'd go,
Very
"Here's your
profound.
PhD."
Exactly, because you can, because you're using
But
all the
yet
right
I go
language.
to the social groups here that we have in our community and they go, when I say some things, they're like, Yes, that's nice.
Hmm.
And I know that I just didn't make any sense, and that I am not able to hold a conversation, but they are so lovely that they see that and they just ignore it.
Now, some people,
Because they're good people.
and thank you for saying that, because some people do this naturally.
Yeah.
Some people are good people. Some people need to be advised in advance that, look, Diane has got communication difficulties. You might see some behaviour that might be distracting, like the tics. You know, if you're seeing Tourette's and you're suddenly seeing her do, you know, sudden ticking actions, or coprolalia or copraxia, that can be quite like, oh, where did that suddenly come from? This is a girl who I thought is religious, but then she's suddenly pulling the finger. Well, unfortunately, 8 to 14% of people with Tourette's might have coprolalia or copraxia. Her ADHD, you might be having a great conversation, but suddenly she is pinging off on subjects you're thinking, where are we? What are we talking about now? Why?
Another thing I do is I'm in my own head because of the autism, that people think that I am being selfish in situations, and I respect that, because it is for their experience a selfish experience, but I get so caught up in my own head that if I'm not with someone who naturally puts themselves in there and tells me stories, which I'm happy to listen to, if they don't do that, then I'll just keep speaking and I won't realise that they haven't had a chance to
You
speak.
also have some other layers
good.
to that challenge. Being autistic with interoception, a lack of awareness of your own internal states, with alexithymia, you don't know what the other person's feelings are. You don't even know your own internal feelings and how to convey those feelings. So that makes it incredibly difficult. You have difficulties with body language. I can look at you and I can read you like a book, but I've taken 35 years of knowing you
and you
to
know
know
what
that.
happens because of this? Like, I could just be talking to someone. This happened at school. This happened in my adult life. And I'll just be talking to someone and they go, oh my gosh, can you stop talking to me? I don't even like you. And they walk off.
Yeah.
Because I don't see the
That's
signs.
showing exasperation.
It's not, guys, that I'm
frustration.
like, you know, harassing someone, or I'm not
You
like
thought you were doing
over talking to them.
You thought you were doing the right
long.
thing.
I'm
You thought
just
you were doing the
talking
social
to them.
skills, right?
Correct. And it's just that I'm obviously not reading. And people are allowed to not like me.
Not reading the body language, not reading the sign.
Yeah.
So when the doctor does this to stand up,
Never used to get it. I still don't get it.
that's the end of the consultation, apparently.
What's going on? And then I'm like, why is he standing up? Oh, is it that thing? And I look to you, and I'm like, oh, are we done? And then you say yes.
Yeah, because you've missed the cues of the wrap up. You might not also be time aware. A lot of people with autism, ASD or ADHD have a time blindness. They're not actually aware. You might have been in, like yesterday, you're in an appointment. There was an hour-long consultation, but the seizure, you probably remember 5 minutes of the entire hour if you're lucky.
Yeah, 5 minutes.
You know what I mean?
Felt like to me.
Right. So I want to bring it back to key strategies, Diane, of what people. Some people do this naturally.
Some people do.
Some people on our
A lot of
comments
you guys
have
do.
got their natural compassion, care, understanding, love, support. They're people who want to build people up, not drag people down. Okay, so for those people, go away. If you're trolls, don't give a shit. Okay, not the channel for you. That's all I'm going to say. I don't want to talk about that word ever again. But the reality is,
IDD is a low blow.
it is a low blow. But for the good people, most of those people probably have a lived experience. They may have had challenges themselves, or someone in their family, or in their surroundings.
Or
They've
their
probably
own
seen
challenges
the real
make
life,
them
because unless
understand.
you've walked in the shoes of the person that Diane is, or even myself as a carer, you don't know the challenges that we face day to day, and that's why we're trying to share this through the videos.
That's that cautionary thing, isn't it, that we all need to remember of never judge others because we don't know the struggle. That's why I would never judge you guys, because you all have your own struggles.
Don't judge the book by the cover,
and
because the cover, you're not going underneath or inside the cover, you're not
should be
opening the book.
judged.
And that's why we show the videos.
Yeah.
That's the reason. You know, you might go, well, that was a bit strange behaviour, I'm not quite sure what's happening here, and you can ask those sort of questions. And that's really the question to ask, because there is probably a rationale or a reason why the strange behaviour is occurring.
I got told off for being, you know, toxic in my car travel to the doctor video, which is ridiculous and rude, because, you know, the first thing is that I've got justifiable, valid reason to be angry right now in my situation. And then, of course, you said it is a seizure thing, and I know this because in hindsight I always see it and go, yeah, I was really weirdly irritable, which isn't like me, and I know it's not my medication because my seizure medication can do it too. But basically, second, who goes there and goes out of their way, which guys in psychology they say, an unstable person is the only person that would actually write hate.
Yeah.
That's the only people. But like, for example, in real life, if someone says to you a hateful thing, because they can hate you, but saying a hateful thing to you about why they hate you is not okay.
That's an aggressive behaviour.
That's not okay. And it's also not okay to write a comment of, I don't like this channel anymore because of this, this, and this. It's like, well, then just unsubscribe, leave.
You've got different alignments or values.
You can hate me, but you don't have the right to tell me why you hate me.
Now,
I don't care.
the reason why I point this out is...
Your opinion of me is none of my business.
Thanks. Why I'm pointing this out is, if some people were actually starting to try and learn more about seizures, you might have a person in your life who's actually got a seizure condition, you need to learn to look for some of these indicators in the preictal, before seizure, in the aura, immediately before the seizure, and that actually helps you to help your person, particularly if you're autistic. With interoception, they don't know that these things are about to happen. Myself, Diane keeps asking me, how did you know that was going to happen? It's like, darling, you have been telegraphing, you have been signposting that you're going to have a seizure. And that's why I created that seizure trigger awareness spreadsheet.
But also,
sorry. I've created that trigger seizure awareness spreadsheet, which some people have actually said, thank you, it's really helpful.
Glad.
It's actually helping us and the healthcare professionals to go, gee, if all of these triggers come into alignment, everything in alignment, what's likely to happen?
I don't like looking
a seizure
at the
like
score,
yesterday.
though.
I know, but it helps you to then go,
I'm like...
right, makes sense. Sorry to interrupt you. What were you trying to say?
What I wanted to say, which is, did match that, but that's okay, because most of the time what I say doesn't match. But sometimes when I pick up the camera, guys, and I do a vlog, and it could be any type of vlog, you will not always know the timing of when I've filmed that. So it might be the next morning of a seizure where I can't speak properly, think properly, I'm going in circles, my brain's still recovering. Guys, a seizure takes how long to recover?
Sometimes
probably
hours.
24 hours.
Sometimes up to days, absolutely.
Or days, it can take up to days. And I will absolutely vouch for that. Sometimes, depending on the level of the seizure, I will take from 24 hours to 2 days.
Heck, if I had that medication that I had to give you, the ASMs, I'd be fast asleep for 3 hours myself. It's like, that's how my body would react to that medication.
That person that said, you're supposed to take your medicine, 4 hours before to prevent a seizure. It was an emergency medication for seizures, which is a fast acting.
Okay. They're not a person with a diagnosed seizure. So
they're not even diagnosed.
Some comments, and we don't always post comments that don't actually match because it's misinformation. We're trying to be very accurate to clinical guidelines. Now, what I'm getting back around to is the strategies. Like I was saying, some people do this
No, hang on, I hadn't finished. So sometimes, when I've had a seizure, I might come across in really struggling ways, and I do apologise, but if the filming distance between the seizure and me really wanting to engage with you guys on a certain topic, I'm not going to be at my best in that video, and you're not going to know. But you good ones know that. You good ones know that you don't know what's going on in my other life. I could be busy, I could be having fire test alarms, or I could be having,
sensory overload,
having to go shopping to get essentials and the sensory overload. You don't know where I'm coming from. I could have had a migraine that 100%. Morning.
Well, just to marry that up, even the example in the drive yesterday, you had your pulse oximeter on. You were apologising for the alerts, the alarms going off in the car 10 times before we even got to the doctor's surgery.
Stop stressing
but the
myself
thing
out
is,
that
alarm system is there to actually draw attention for us to know that Diane's gone tachycardiac, or maybe her respiratory rate has gone below 90 threshold, and her body is not coping. That is actually a situation where most people go, I'm going straight to hospital, okay? Do not pass go, do not collect $200, straight to ED.
Some people
we have to live with it. So anyway, now I want to refocus off because of time. She's going to go to the toilet again. All right, off you go, wee break. At least she's on track every 15 to 20 minutes at the moment. You're deflating like a balloon as I'm watching you at the moment.
I know, I'm getting skinnier. Guys, it's weird.
This is what a loop diuretic
full
will actually
body
do. But that's also
edema.
what causes pressure again on the heart and creates an orthostatic
Causes
intolerance.
pressure around the waist with elastic.
The last part, because I'm trying to bring this information together, is these strategies, the key strategies for effective, respectful communication. You also noted while we're doing that little toilet break that you were saying, I want to apologise for all these little side stories.
I'm having some good memories coming with the HSAMs. Rolling
highly
on, and I'm like, I want to
superior
share. Sorry.
autobiographical
Yeah.
memories. Exactly.
Some fun memories.
But that's how your communication style is. So sometimes why we want to be succinct, why we sometimes want to try and just get the information out, sometimes we simply can't do that. To be respectful, to enable Diane to participate. And the stories are useful. Okay, very interesting. Sometimes they're funny, but they're actually also important. And also this is something which we have to allow for. Now again, if you haven't got the time to do that, I respect that. You don't have to watch that. It's your choice. We're not. No one's forcing you.
Yeah.
Just remember that. No one
It's
has
your
told
choice.
you to watch this, but we enjoy the fact that those who do, and some people are studying this to learn more, to create an understanding of the condition and what to actually do. So in this case, with effective and respectful communication, we're going to go through some of the tips and techniques of what needs to happen. Fundamental principles. Number one, assume competence. All right. Treat adults as adults, not children, regardless of their support needs. I think all adults earn that badge as you've gone through the years. You're 51 years of age. You've got a condition that's got 3 peaks. You're chronologically 51 years of age. You've been on this earth 51 years. You've had 51 birthdays. You've done it hard. Your physical condition causes your internals, your symptoms to appear as if you're 3 decades older, as if you're 81 years of age. And that's really hard because you've got so many medical complications around that.
Especially
but then your
20 years younger
mind, developmental behaviours, your physical appearance, because of the connective tissue disorder Ehlers-Danlos and the collagen, makes you smooth skin. All your family, all the females, all look 20 to 30 years younger than they happen to be.
Yes.
Intellectually, you've got IDD because you were born with GDD, because you've got a genetic condition that says you're predisposed to not being able to learn, neurodevelopmental.
Separate to you guys, the only people that I actually am capable of connecting with in a normal way online is other people that are way younger than me. But I relate to them because of where I am developmentally. The people my age that I get along with are always those people like you guys, extra kind, special, compassionate,
gentle,
authentic, accepting of everyone, people.
So understanding these fundamental principles, speak directly to the person with IDD. Do not speak only to their caregiver or their support worker. Maintain eye contact and include them in the conversation.
Well, I don't know about that if you're autistic, but anyway.
No,
it
doesn't force you to have to maintain eye contact. It's them to say, use their social skills to say, I'm not just going to talk to the caregiver. And this is one of the difficulties in a professional environment. To bring the person in has to have some accommodations. You've got to slow things down. You've got to change the language. You've got to use diagrams. You've got to give more time to the appointment. But to make them feel part of it, look to them. Give them that eye contact. Don't just exclusively talk to me. Use person first language. Say the person with a disability rather than a disabled person. Be patient with time. Provide extra time for them to process the information and formulate responses. Don't rush them or speak for them. You will see a lot of the time me pause for quite long durations just to allow Diane to get that burst of communication through. I will sometimes have to redirect if she's going off on tangents to bring things back. For this type of thing, because we can't be here for 2, 3, 4 hours, I do need to redirect. I have to adjust.
And it's really good information, but I don't put it up because it's too long.
Absolutely.
Okay, but tell me, guys, if you've got time, let me know because they'll put them up.
But it's also hard in the public health system to obtain that extra time for a clinic appointment or a specialist appointment or a doctor's appointment so that they can slow things down. But then if you don't make that accommodation, how do you expect them to participate? Where's the accommodation for them to be able to process? And processing takes a lot of time, particularly if you're flooding them through with lots of questions. It's like they're still focusing on question number 1. And you're up to question number 5 already.
One thing at a time.
One thing at a time.
She said one thing at a time.
Make sure they understand that. And I'll talk to you a few more things that can be done. Part 2 is the verbal communication strategies. Keep it simple. I like the kiss. scenario, keep it simple, stupid. All right. Use short, direct, concrete sentences. Avoid metaphors. Avoid slang, abstract concepts, or complex questions. Examples.
No one does. They always. I do not understand out there. I really don't.
You're seeing it firsthand.
I
She's
don't
telling you right now
understand.
she doesn't understand. Keep it simple.
I
okay?
don't understand. They always use those things
Right,
because
these
they
words.
must be, because what they say is words, and I'm like, what?
Exactly. So
It's
she's
words of English.
thinking inside this mind. You can see the wheels turning, the
It's
smoke coming out.
frustrating.
She's trying to focus, and you're already on to questions 2, 3, 4, 5, and 6. She's still trying to go, what was that word that you said? What does it even mean? What does it mean to me? One thing at a time. Ask one simple question at a time and focus on one topic before moving on to the other. Use yes or no. Direct questions. Ask questions that require simple answers rather than complex explanations. You know, can you tell me yes or no to this? You know, are you feeling hot right now?
No.
That's all I needed to know.
So
I can move
had
on.
to think about
That's okay.
introception as a bit of a delay.
That's okay. But that's allowing for the delay. Don't go on to asking question 2, 3, 4, 5. Allow for the
Yes,
delay,
if that
the thought
was a
process,
practitioner,
consider and
Matt,
fact.
if that was a practitioner asking that, they would have said something else, and then I would have been like, what did you ask me? And
Yep.
then I'd have to like scan my body again with my
Yep.
interoception. It's like, don't talk. I have to, because if someone's talking, I can't think.
Now here's another thing that some autistics and some female autistics I notice do more so.
Yeah.
And that is saying yes to please you. So you need to verify the understanding. Do you understand what I mean by that? Have you felt that you do that from time to time? I can see emotionally triggers and symptoms to that.
I do it a lot.
You do it a lot. Simply
in
why?
situations out there that are not with the controlled people,
Mm-hmm.
because
Part of the mask.
no, it's just I'm used to. Well, I mean, what do you say? Like, you know, hey, I'm a bit retarded. You know, like, what do I say?
Okay, so you're finding it hard to actually explain, look, I didn't get that, I don't understand. And the reality is for us to know this, if we know that you've got problems, rather than going, she said yes, but is it actually
don't know what to
correct?
say.
Maybe we need to verify. Did you
So I just say,
understand
yeah.
the question that I asked? And that's my responsibility that I
It's
have to
gotta
take.
feel safe too from
knowing
that
that.
person.
Mhm.
It's got to feel safe
You
that
go.
for me to say, if it was the case, I don't understand.
Sure.
It's got to be a safe
Understand? I get that.
person to do that with.
Avoid why questions where possible. So instead of why'd you do that, ask what happened or what did you do? It's just reframing, changing the language.
Another thing that I think people do too is, you know, they respond to me because they aren't comprehending me, which is not their fault, but they snap at me because they think, you know, what stupid thing are you saying? And because I'm not a
Rather
person
than
to
clarifying.
say stupid things,
Mhm.
because I won't speak. If I don't have a fact, I won't speak. But the fact is, I would prefer someone to say, did you just say this?
Correct.
Or
Clarify.
am I wrong?
Ask the question,
I would
get more
prefer
information.
that because
Mhm.
so many people misunderstand me, and
That's-
I don't blame them.
That's actually,
I know why.
that's one of the points
But I
here.
want to be able to say, no, I'm talking about this situation
Right.
over here.
Exactly.
And then they'd probably go,
Mhm.
I got it wrong. And it's like,
Yeah.
that's okay. I'm difficult to understand.
This is under point 4 when understanding breaks down. Never,
can be bad.
never pretend to understand. If you don't understand, you're the receiver. It's disrespectful to pretend that you did. Say instead, I'm sorry, I didn't catch that, or I didn't understand that. Could you say it again? Could you clarify for
no,
me?
people fill it in what you mean.
I know, but they're not taking the time to do that, and they shouldn't fill it in because that's
Not
assumptions.
you guys. You guys
If people
can't.
fill it in, they're filling in with the wrong information. They're not getting it from the source, and they need to
Yeah.
actually clarify what's going on.
Okay.
The other part to this is use a normal tone. So speak in a natural, polite tone of voice.
Speak
Do not
like
shout.
I'm
Remember that
normal.
example that I gave of shouting? And Diane was actually quite intimidated. She took a bit of while to process it. Actually created a bit of a trigger mechanism because I'd be intimidated if someone was
So
standing
she
over
has
me,
fear and anxiety.
using a loud voice, using a male voice, ooh, I'd be first of all thinking, shit, have I done something wrong? What have I missed? Oh my God, am I going to get into trouble? Am I going to get hit?
Has fear and anxiety.
Bingo. So that creates a context to that understanding. So do not shout. This can heighten anxiety and doesn't help with understanding. Okay, yelling something doesn't make it any better to understand.
It makes my brain switch
You might
off.
need to actually slow it down.
Frontal lobe.
You might need to quieten it. You might need to actually use better and easier to understand words, or write a diagram. Non-verbal and visual support. Talk about the diagrams. Use visuals. Use pictures, diagrams, actual objects, or gestures to support your verbal message. Use first, then language. So you structure the information clearly. In other words, first we're going to go to the shop, then we get the ice cream. Sequence one thing after another. All right. Observe the behavior, and that's what I do a heck of a lot. Not just your behavior. I observe how you're interacting and the behaviours from other people towards you, so that I can help you. I do through really social stories. And a lot of autistics use social stories to comprehend, to revisit the situation, to see maybe what was done wrong and what other pathways could have been actually employed to improve the outcome at the end of the day. So observe the behaviour, be aware of their body language, facial expressions, as these may indicate their feelings of need. You saw just a little while ago when I was saying that example of, you might say yes to please you. You saw Diane's face. If you didn't, just rewind it back about 5 minutes and have a look at the facial expressions, the eyebrows, the mouth. The expression, the body language actually says it all. It conveys more meaning than any singular word that she's going to say in this. She was relating to going, I do that. I feel really bad about that. I'm not coping. That's what it says. Reduce distractions. Anybody who's got a sensory disorder, such as autism, you don't want flashing lights. You don't want loud motorbikes or a fish aquarium or a lawnmower. You don't want it to be freezing cold. You don't want someone touching you and poking you and prodding you.
Stop touching me.
These are distractions, especially when in a new or a stressful environment. So think about what an ED or a medical clinic environment would be. Think about if you're about to go into a seizure and you're thinking, please, I don't want to go into a seizure. My heart is pounding, literally, it's 160 beats a minute. And my God, and I'm sweating. And oh my God, my stomach feels like I want to puke.
But
that's pretty full on. This is what the sensory overload that person is going through. And you want them to be able to cope and have a cognizant conversation with you? Don't think so.
But then there's assumptions that I am, just because I can say words and I'm having a conversation, but really I'm like, I have no recollection of yesterday. Yesterday is just not there.
Correct.
It's just not there. But what did you say before the first example?
The reduce distractions, minimise background noise, distractions in a new or stressful environment.
Yeah, basically, like that happens a lot, is that sometimes people don't make allowances for the sensory issues. Like the hospital situation, for example, ED for me, and of course there's been emergencies for me, as you guys know, over just the last year or 2 years, but basically I can last I think we worked out 6 hours with headset, watching movie, headsets to block out sound, fidget toys. I can only last, and I have to take my hoodie, because in our hospitals it's like Alaska.
Yeah, freezing cold,
you take really long woolen socks, you have your hoodie.
You do everything right.
Which is a blanket basically that you wear.
And your threshold will go between 4 to 6 hours before you peak out.
4 to 6. And then I'm like, and then it's like this, Shannon. This is my...
Are you body slamming?
Ready?
Oh my goodness me. I'm just going to talk about, just because we're conscious of time, sweet.
Sorry.
One of the things I do use in the hospital, the clinic environments, and even the ED, and this is on file at all the hospitals throughout Perth for Diane. So if she enters in by ambulance, even the ambulance team have got a copy of this. This is a medical support information for Diane in this environment. It explains her conditions, it explains some of the things that are going to cause problems, her communication, where she might say yes when she doesn't even mean it,
really nice about
what's going to upset her, what's going to help them to improve their outcome, what's going to help them to improve their communication. If they know in advance, if you've painted the picture, if you've done this conversation that we're doing today with them, they can actually have an informed interaction. They will improve the interaction and you get a better outcome. And that's why we spend the time getting these sort of things done. The last little part as I finish off here, because we're going to wrap up for time.
it.
I've already said that when understanding breaks down, because it's going to. People make a lot of assumptions. It might be on the beauty effect, just because you're wearing nice pajamas, your hair's brushed, you got makeup on. It doesn't tell you what's underneath. I mean, I know I'm terrible about telling people that
My life is not perfect.
I'm terrible about telling people that I'm in pain. Okay, I know when I've had severe migraines, I just keep going.
Me too.
But it must make me very irritable. I can see people go, "Wow, you look incredibly tired." Yeah, because I've had 2 hours friggin' sleep. Sorry, didn't mean to say that, but you should know that, shouldn't you? Oh no.
Carers.
Okay, but that's the thing, is they're
complex
not going to know
people.
that. So unless you actually put out the
You
context
don't
for people,
know that life. You don't know
they
that
don't
life.
actually know. So rephrase.
It's a full moon too. Right
Rephrase, don't just repeat. Saying the same thing over again is not going to change the understanding. Just as much as yelling at the person the same thing,
Comprehension is my problem.
you might need to rephrase it. Change the structure, change the words that you're using it, simplify it. If they don't understand it, rephrase the sentence using different, simpler words rather than just saying it louder. Okay? It doesn't work that way. Use a communication diary. If working with a person regularly, create a personal communication dictionary to track the specific gestures and vocalizations. That's part of what we do this for.
And they love it.
Carers who come into us, OTs that come
Some
into us,
doctors.
clinical professionals,
It's helpful.
neurologists, whatever, they can read through this and they can go, okay. Even your doctor yesterday was going, oh, I should have known that. Yeah, you should have. Okay,
What?
you should have picked that up in things like the hate sound.
Yeah.
Because it's like, now it like, oh, that makes sense. Oh, and it's also found in 22q. That even makes more sense. And you're autistic and, oh my God, all of these things are painting the picture.
It's not trauma.
And it's not their
guys.
fault.
It's
They
just memories.
aren't
They don't hurt you.
Educated to bring all
Well,
of this wealth of information
negative.
together. So I get that.
Wow.
But sometimes if you create communication, you've got a communication diary that you use when you go to the hospital.
Yes.
You have an
My
actual
AAC,
book.
And I have my own profile book that my
Yeah.
speechy made with me. And people
Speech
like
therapists
me.
are
And-
gold. They really do help.
Yeah, and basically most of the nurses will flip through it on my table,
Yep.
wherever I am, whether it's ED or in hospital,
Yep.
and they'll go, oh, this and that, and and then they start to communicate to me, and then just a short conversation, that sets them up, and then I hear them say that in the handover of
Yep.
this person, this is what, like,
Yep.
it's funny, sometimes I even
It's
hear
all
in
documented
handover,
there. Just read it.
Sometimes I even hear in handover, and she's got a kitten right now, a rag dog, real cute apparently. I've seen a photo of it. Like basically, sometimes you'll even hear that kind
Yeah,
of thing,
you will.
and that helps for me because when
Breaking
I go
the
into
ice.
hospital, I'm no different to a child. I will cry. I will be scared.
Because
I
you've
don't
got
like the change of environment.
IDD,
The
yeah.
transition for autism is
100%,
impossible.
exactly.
And then, of course, the IDD.
Now, the last little part is actually about that medical and professional settings. Check, this is for doctors, this is for specialists, clinicians. Check for understanding. Use the teach back approach. Okay, it's a method where you ask them to explain what you was just discussed, rather than
I like
asking.
that.
So don't say the
Yes,
statement.
please.
Do you understand what I just said?
That doesn't work.
Can you just
But that's-
explain to me, teach me back, tell me what you've learned from that? And then that way you get to
Yes,
see the
please.
understanding, and maybe you can correct,
I'm up for
redirect,
that.
fill in any of the
I
gaps.
can do that.
Also for medical professionals, use easy read. Provide written information in easy read, simple text, with pictures preferably. Your geneticist said that to the
She said
hospital.
that.
Allow for also for familiarity. Communication is often more
Yeah.
successful
I have
with
to be
people
familiar with my
familiar
doctors.
to you.
Yeah.
So we need to work with the team, the
Well, it's the same
carers,
with the
to learn
nurses.
the preferred
I
communication
noticed the
style.
one change that they've made in Australia since autism
Hmm.
became right, we're actually going to think of it, is they try and give you the same nurses.
Consistency,
Right?
yeah, for
and
a reason,
I
right?
noticed that the nurses do that
Mhm.
for themselves to you because they notice after one shift that you're different
Hmm.
and there's many ways they notice, I guess, and they do, and that happened for me.
Now that's
and it
common
is
sense.
good.
That's a practical
Well,
staff management,
it's safer
just
for
way
them
more
and it's
efficient.
safer for me.
I
Yeah.
like that. But that's why we also have the communication passport in the hospital. This is why we also have this document, which a single page, and keep it brief, keep it simple, an executive summary, one single page document to say this is my needs. And it actually allows then for accommodations for your disability. It improves the communication. It creates context to the why. Why are we doing this? What is needed to improve, and therefore you get better outcomes by doing that. Thank you so much for joining us in a very long conversation today about GDD and IDD, particularly pertaining to Diane, and with the context of being 22q11.2 deletion syndrome, a rare genetic chromosomal disorder. Most genetic conditions, 80% of them in general, will create GDD and IDD in their patients. You may grow out of the GDD phase from 0 to 5 years, but as from 5 and onwards, as you're entering into the school environment, you might have IDD, intellectual or developmental disorder.
Everyone with IDD, no shame.
No shame, absolutely.
No shame.
Because you can't do what you can't do.
The people that treat IDD people bad are the most disgusting people that walk this earth.
Absolutely.
And there's no place for them here on this earth. And all I say is we give it to God, because people that can pick on the most vulnerable of society is absolutely just next level evil.
It is, absolutely. I hope you've enjoyed today's conversation. Big thumbs up, hype the channel, comments, questions, ideas, suggestions, leave them below. If you're new, don't forget to subscribe, hit the notification bell, and share our channel. Have you got me? Have you got me? I've got to go into a meeting right now. I've got a meeting in 5 minutes, so I'm busy. He's okay. He's fine.
You got fluff on
So
your
we are
neck.
going to see you in another video real soon.
Thanks, guys.
Bye for now. Thanks for
listening.
watching.
Bye.